Dr. Paul Offit now, Director of Vaccine Education Center at the Children's Hospital of Philadelphia. Doctor, thanks so much. These new tests of vaccine effectiveness versus these new variants, they were done in test tubes. Are we to expect the outcome, do you expect, that the outcome will be the same in people or no?
Well, you're starting to see some evidence. In South Africa, Johnson & Johnson, for example, did part of their trial in South Africa with their vaccine, and as did Novavax did part of their trial in their vaccine. So that's really where the rubber meets the road. Will these vaccines, which are really designed to prevent the first variant, which was the variant that left China and swept across the world. It has the name D614G. That's the virus that most people have been infected with. That's the virus that we made vaccines to prevent. So the question is, as Dr. Fauci points out, do these vaccines prevent severe disease, critical disease, meaning hospitalization, ICU admission, death? And to date, at least those studies by Johnson & Johnson and Novavax suggest that it would do that. But you're right. I mean, when you test something in the lab, you're testing whether or not antibodies neutralize the virus. But there are other parts of your immune system. And so that's where the rubber meets the road. The rubber meets the road in the real world. And right now, we have not crossed that line. We do not see people who've been naturally infected, people who've been immunized, who nonetheless are hospitalized with one of these variants. That's good. That line hasn't been crossed.
Yeah, that's fantastic. But, you know, there is some hope as well that a booster shot can be developed to give us more immunity to these new variants. Of course, time's not on our side. What's your thought on that?
Yeah, and the booster shot, it's interesting, when you get a booster shot, even just against this virus that we're currently, that's the most common virus circulating, that also sort of creates more cross-reactive antibodies, if you will, against these variants. So you don't necessarily have to boost with a different vaccine. But again, if a variant gets to the point where it completely resists immunity induced by natural infection or vaccination, then we're going to have to create that second-generation vaccine. Right now, it might just mean a booster shot with the vaccines we've already made.
Hey, you know, supply is short. We all know that. And there's a new study that suggests the second dose of the Pfizer vaccine could be delayed because the first one is highly protective by itself. We've been going through this a long time. But have your thoughts on this changed? Is one dose the way to go?
No, certainly no. I mean, the second dose of either the Pfizer or Moderna vaccine dramatically increases the neutralizing antibody titers and induces the kind of cells that suggest you'll have longer-term memory, meaning that the vaccine would last for a few years. I think if we have people who just get one dose of vaccine, which will give you shorter and less complete immunity, that's only going to create variants. So we need to know that this is a two-dose vaccine, period.
Dr. Offit, thank you so much. Shepard Smith here. Thanks for watching CNBC on YouTube.